Every day they're seeing many, many patients. I think our staff and I think all healthcare workers right now are heroes. They're the ones who are putting their lives on the line right now to see and get up close to patients. They can't really implement social distancing because we have to take care of people just as if we are providing as much as we can, as much as we are providing services on a regular basis. So those are the real heroes. I brought one of my heroes here today with me. Her name is Charmaine Willis. She is our nursing director, and I'm sure you'll be hearing from her in a few minutes as to what's going on and perhaps be able to answer some of the questions that people may have. But I'll just say this as I close my introductory comments out, and that is we should try to stay home as much as possible. Going out, anytime we go out right now, there's exposure, and the cases are anticipated to rise in the next few weeks, looking at a peak in late April. So it's very important that we take all the precautions that we can, wash our hands, stay home as much as possible. I know we have cabin fever, but right now it's important that we get through this next 2 to 3 weeks, and then hopefully we can start to get back to normal here real soon. I'm not making any predictions, but I'm hoping we can get back to normal soon.
Great. You mentioned something. Can you mention, tell everybody your phone number, how they can come there and get appointments for services, and also the addresses of your Memorial Drive location, Candler Road. And then as an audience, I just got off a call at 10 o'clock that our CEO, Michael Thurman, is doing around the task force. And Dr. Ford reported, which is our health center director, over 300 cases is in the cab right now. We represent 8% of the cases for coronavirus right now. And so it's very crucial. The cab has a shelter-in-place ordinance in effect. So if you don't have to go out you can go out for like groceries or medicine. Of course, exercise, but you have to maintain social distance. That's very crucial in this time frame and where we are. And so please mention those phone numbers and addresses and how people can get in contact with you.
Absolutely. Our phone number is 404-298-8998. 404-298-8998. And when you call in, you can set an appointment. Some individuals are calling for testing right away, and what we're doing is actually doing a phone screening with them to determine whether or not they need to be tested. So that's a part of the process. That you won't get that screening immediately when you call, but that's a part of the process in being able to see a doctor. We are located at 5582 Memorial Drive. That's our main location. Those of you who are familiar with that, that's close to the Chick-fil-A on Memorial Drive. And then also we are located on the corner of Candler Road and Glenwood. That's 1760 Candler Road in Decatur, Georgia. 1760 Candler Road.
Wow, great. And so it's very important that we have this asset in our community. They offer dental, they have primary care, they have a lot of the service you would find at a major hospital or healthcare institution. And so that's why we're highlighting Oakhurst Community Health Center today. Mr. Taylor, can you introduce your staff member and let us say a few words, because you mentioned something that was very, very important. And I want us to always keep this in mind. The healthcare workers are on the front line each and every day. I commend our doctors. I especially commend our nurses and what they're doing. Even the receptionists, the janitorial staff. This is some crucial times for them. And we just thank you both, Mr. Taylor and Nurse, I'm gonna call you Nurse Charmaine. I don't have your last name, but please introduce her and tell her about her role and how critical nursing is playing in this time.
Absolutely. So again, I want to introduce Nurse Charmaine Willis. She's been with us for a good part of 20 years, and she is managing our staff who are on the front lines. She herself is on the front line. She's very knowledgeable and is up to date on statistics and everything regarding COVID-19. So at this time, I'll introduce Charmaine and let her make some introductory comments.
Thank you.
Hello, good morning. Again, I'm Charmaine Willis, and our staff here, our clinical support staff, as well as our providers, are really committed to providing the care that our community needs. We understand the emotional and physical toll something like COVID-19 has on our community. And I will say that we have a group of individuals working here on the front line, not just the clinical individuals, but those that are helping us with registering patients or non-clinical staff. Everybody here has really impressed me with their commitment to taking care of the patients in the community. Some of them are understandably fearful, but they're still pressing along and making sure that they are doing what's needed to provide the care or community members need. So we're really pleased, I should say, to be able to provide this care here at Oakhurst Medical Centers. And if you are having any symptoms or questions regarding COVID, please feel free to, if you're having any symptoms of fever, any dry cough, if you know you've been exposed to an individual that has tested positive, or now the guidelines changed yesterday to also include individuals that may not have been tested, but those that have clinical presentation or symptoms of the COVID vaccine, of the COVID virus, we want you to go ahead and reach out to us. We will ask you questions that are pertinent to COVID-19 and make sure that we screen you appropriately to determine testing need. Our number is, again, 404-298-8998, and you'll be prompted to be sent to a clinical staff that will be able to assist you.
Nurse Charmaine, thank you for that, that overview. Tell us how critical nursing is in this moment, and talk about a career in nursing, because we know we have a shortage. But I just commend you, been in the field 20 years. And I know when I go to the doctor, the nurse is the first one to check me in, do my blood pressure, do my weight. So you all are very special people. But talk about what nurses' roles are as we deal with COVID-19. And then talk about a career path in nursing.
Okay. Well, nurses, as we're all finding out through media and through other platforms, we are the ones that are providing that direct day-to-day patient care. We're the ones performing testing. We're the ones taking the patients, more specifically those individuals that are working in the hospital. Hospital work is not easy. I did it for 5 years, and I commend all the nurses that are on that front line taking care of patients, and physicians as well. But more specifically, the nurses that are caring for these individuals that are going through this challenging time. Here at Oakhurst, we're not in a hospital setting, but as patients come in, we are the first line of contact prior to where we have transitioned to screening individuals coming into our facility, and our nurses are the ones that are on the front line doing those screenings to make sure that we are keeping our patients and our staff safe. In addition to that, we're providing emotional support. Earlier, you mentioned the need for mental health and behavioral health. As we would definitely understand, there are individuals going through this that don't only need the physical care, but they need the emotional care. I'm very impressed with nurses that I have heard that are FaceTiming family members to help patients transition through their final hours. And that's just as important as the physical care and the medication that we're providing. Emotional support goes a long way in helping patients with recovery, and also helping them with being able to transition as they go through the last few hours of their lives. Now, a career in nursing is very interesting. It's a decision that you need to make. It needs to be an informed decision. Yes, there are a lot of opportunities in nursing, but we need to make sure that we're prepared for the emotional strain that can place on your personal lives, as well as your physical experiences in your job. We're always going to be an essential career choice. When most things will come to a halt, as a nurse, you're still going to have to be at work. I remember being up in New York as a nurse and having to work through blizzards. You know, you have to get picked up and you come into work. It's not an option for you to say, okay, the city's at a standstill, I'm going to stay home. We don't have that option. You can go through the channels of identifying a university or a college that works for you. There are now online programs that are available for you to be able to accomplish a career in nursing. And it's an area that's always in demand,
Right.
not just in Georgia, but also nationally. So if it's something that you think you would, definitely I would encourage anyone to explore a career in nursing.
Great. One last question, and this is for people who have family members who are in healthcare right now, workers like on the front line. What would you tell the family members on how they should be interacting with someone who's on the front line in nursing and the medical field right now, just to keep them encouraged to do certain things that can just keep their hopes up? What would you say to a family member who may be dealing with?
I love that question. Maybe my family should be listening.
I know they got a plan for you when this is over, so I hope that they need a 7-day cruise, and Mr. Taylor gonna help pay for that. And that's
yes, that would be good.
That's exactly what would be perfect. So for family members, continue to provide the emotional support that you have been. And if you haven't, understand the emotional strain that comes with this career. When we come home, this is something I communicate to my family all the time. For us to be able to really function, and because, you know, family life is also extremely important to us.
right.
But we at times need a few minutes to decompress when we get home. This is a conversation I try to have with my family. When I come home, or even on the way home, please don't ask me or ask other nurses or healthcare providers for everything that you've thought throughout the day that you need us to do this, please do this, please do that. We need a few minutes to decompress, and then we'll be at a better mindset and be able to help the family a little bit more. That's so that emotional support, I think most nurses would say, or physicians, this is kind of what we talk about. If we could get a few minutes, we definitely need that. Whatever else you can identify in your home, because we all know, sometimes we don't act, but we know exactly what our family members need. So if you know your wife or your mom would appreciate coming home to a cooked meal, or coming home to a home that's already cleaned, and you don't have to go around saying you didn't do the dishes, you didn't need it to clean. You know, those are the things that are really helpful. Men are in healthcare now and functioning as nurses, but it's traditionally a female career. So a lot of us have the responsibility of taking care of our family. So if family members, children, spouses, and any other family members could help us that way, we would love that support.
Excellent. We're gonna have you do like a story at some point to talk about that. But I think it's important for us, as anybody that's listening, if you have any questions, please, our staff is getting those questions. If you have any questions as we continue this dialogue, please ask the questions and what we need to know. Now I'm gonna go back to Mr. Taylor, the CEO of Oakhurst, and on what you're doing. Talk about, I'm gonna switch the gears for a moment, because today is April 1st, and we're not just talking about April Fool's Day. This is the first day, this is Census Day. And being Census Day, I want to remind people that being counted plays a big impact into healthcare infrastructure. The funding that you receive come from the federal government. You are FQHC, and I want you to tell me what that means. But talk about the federal dollars that you receive and how that helps you with prevention and primary care for the residents of DeKalb County. And just remind people, please fill out the census. Only 10 minutes, 10 questions. You can do it online. It's easy, but it will help nurses like Charmaine, who may have to deal with critical care. It allows them to find out about prenatal services of moms in the community or people. But Mr. Taylor, talk to us about federal funding and how it's important.
Thank you. I'm glad you brought that up. We are a federally qualified health center. That's what FQHC stands for. There are 34 health centers like us in Georgia and 1,400 around the country. And I want to encourage everyone, as you just mentioned, to complete the census form, because what that does is when the federal government starts looking at how it's going to allocate money throughout the United States, they look at the census. And if we don't completely fill out the census form, then the federal government technically doesn't know that we exist or that we're here. And so as we look at our funding for health centers and other federal programs that put money into the state of Georgia, it's very important that we get our share. I think there's estimates, and Commissioner, you may know this a little bit better, but there are estimates that we're not getting the full amount that we could be getting in our community because the census form is not completed. So as those dollars flow to Oakhurst each year, we can provide that front line, as we've been doing, that frontline healthcare services. One of the interesting things about what we have to do as a health center is we are held responsible for the healthcare measures of the individuals that we serve. Oh, so wow. The federal government asks us, they say, hey, if 50% of the individuals in DeKalb County have blood pressure over 140/90, they ask us to get that number down to 40%. And so we can only do that if we see you, if you come in, if we take care of you. And of course, we want to make sure we have the adequate resources to be able to take care of everybody who comes in. So it's important to fill out that census, so as those dollars flow, we can do everything that we can to make DeKalb County a healthier county.
Great, I appreciate that so much. And so folks, it's mycensus2020.gov. Please go to that site. You can fill it out online. It's easy. It took me about 7 to 8 minutes to do it. But DeKalb County, last census was in 2010, and we had a 72% return rate. And in that, having that return rate, we had a chance to only get, we lost $275 million to make that happen. So we're trying to get $1.8 billion a year for the next 10 years. And we need everyone to fill out that form. Right now, we are probably at a 33% return rate. So we're doing a little bit better than the state. But I need folks in our area to make sure that we get that information in so we can have the resources and the things that we need to make our community strong. So thank you for that, Mr. Taylor. Is there any, Mr. Taylor, are you all doing any hiring over there?
You know, you're asking at a very difficult time right now, quite frankly. Yeah, we have been in an expansion mode the last several years. And right now, at this very moment, we're kind of holding it close to the vest. But, you know, I'm anticipating in the next 2 to 3 months, we'll begin to get back to normal. And at that time, we will be doing a little bit of expansion then. And then also, as we open up our new facility, we're anticipating that the facility will be open on Candler Road in the late fall. So we'll be having some additional positions there at that time.
Great, great. So are there any questions, staff, that we're receiving? Because we've had a very rich dialogue. We learned about the services Oakhurst offered. I'm going to have him repeat that phone number and the addresses again. You heard from a nurse who's been in the field for 20 years on the impact of nursing and what being a caregiver could be as well. But these are vital services right here in our community, in District 3, in DeKalb County, and health clinics are on the front line each and every day. Mr. Taylor talked about they offer a full range of services right in our community, quality service. I mean, doctors, they have nurses, they have dentists. All of those services are right here in our community that we can take advantage of in our community. So if I don't hear any questions, but you can go to my website to look at this recording again at commissionerlarryjohnson.com. This is our first one called Touchpoint with Commissioner Larry Johnson in District 3. And we had here our inaugural guests were Oakhurst Community Health Center, who's doing a very fabulous job on the ground and connecting with us. And we will be with them on tomorrow, Thursday. We're going over there. We had some masks donated from our beauty supply companies here in DeKalb. We're going to donate 1,000 masks to them so they can have it because there is a shortage. So if you're here as a resident or a business person, if you have donations, please, Mr. Taylor gave you the phone number. They need masks, they need gloves, they need ventilators, all the things that you may hear about in a hospital. We can help provide that. If you have it, please take it to Oakhurst. They have ways to receive that donations to help them out. So again, we will be back. We're going to do these on Wednesday. Our next guest will be from Stand Inc. This is a substance abuse prevention place in our community. You're going to hear about services because as folks are sheltering in place, we know substance abuse rises, domestic violence rise, mental health issues goes up. And so we want to provide this venue as an opportunity for you to learn about resources that are available in our community that can help you, your family, and your community to be the best as we deal with this hideous virus called COVID-19. So, Mr. Taylor, before we leave, give us the address of Oakhurst and also the phone number that people can set up an appointment if they need services.
Also, Commissioner, we have 5 questions.
Okay, all right.
Thank you.
Let us go to the questions first,
okay.
and then we'll let you end with that information. Yes, sir, Sean. What's the question?
So first question we have is, how do I know if I have it? I guess the coronavirus.
So I can answer that question.
Okay.
Best thing to do if you're having any of the symptoms I mentioned, which would be a fever, a dry cough, if you know you've been exposed to someone that has either tested positive or is really symptomatic of COVID, then what you would do is reach out to your healthcare provider. You would call, don't just show up, call, and we will go through a screening process, a much more in-depth screening process. At the end of that screening process, we would determine if that individual would need further testing and do the appropriate referrals or process based on the CDC guidelines.
Commissioner Johnson, let me just interject something here too. This is Jeff Taylor. If you come down, many people who have COVID-19 don't show any symptoms. And if you come down with COVID-19, it's not a death sentence.
Right.
Many individuals, hundreds of thousands of individuals have fully recovered from COVID-19. We still want to take it seriously. We want to shelter in place. We want to stop the spread of it, particularly for the elderly, particularly for those who have underlying conditions. Those are the ones that are most vulnerable to this COVID-19. The underlying condition is high blood pressure, diabetes, if someone has cancer, if someone has anything, COPD. Those are things that those individuals are the real serious ones if they come down with COVID-19. But I just want to assure people that it's not a death sentence, that take care of yourself, do everything you can to prevent. And if you are experiencing any of those symptoms, call us first and we'll do a screening for you.
Thank you. Next question, Sean.
Should I wipe down my mail and packages?
Yes. That is actually a good recommendation. That's something that I personally am doing in my home. Prior to opening mail and packages, I would let them sit for several hours before opening them. And if possible, if it's something that you can wipe down, you have the ability to do that, it's always best to be on the side of being ultra cautious. It won't hurt. It's not something that, it's a small thing that can be done.
Mm-hmm. That's right.
to prevent you becoming or your family becoming exposed. So in addition to wiping down your mail or packages or letting them sit for several hours before opening them, what I would do is, if you have gloves or if you have a paper towel or something when you're taking it from your mailbox, I would make sure that there's a barrier between my hand and that mail. In addition to the barrier, when I get back inside, I would wash my hands for at least 20 seconds, sing the happy birthday song while you're washing your hand with soap and water, rubbing vigorously to make sure that you're able to get rid of any virus that may have gotten onto your hand. It also helps with the pollen. You know, this is allergy season, so it makes it a little bit more complicated identifying what's a cold, what's a flu, what's an allergy, or what could potentially be COVID.
Thank you so much. Next question, Sean.
Is it airborne?
The information that we currently have says it's droplet. I know there has been some talk about it being airborne, but what we have is that it's a droplet precaution. And what that means is that any type of, if you speak, and you know, sometimes when you speak, when you cough, when you sneeze, there's a potential for mucus or some type of fluid from your body to be ejected from your body. And that is something that you would want to make sure that that's why social distancing is so important. Staying that 6 feet away from individuals. So even if there is some droplet, that's gonna fall maybe 3 to 4 feet away from that individual. If you're 6 feet, it makes you safer. Very, very important. I'm looking at the news and I'm seeing that individuals are not consistently practicing social distancing. And I can't stress enough how important that is.
And also stress, Sean, that we sent something out from the World Health Organization, which talked about what Nurse Charmaine talked about. That's it's not airborne, it's droplets. And so please, whoever sent that question and send in that ITC to let them know about that information. Next question.
When should I go to the doctor?
Go to the doctor if you are told to go to the doctor. So again, the first thing you're gonna do is call. And most practices, I know we definitely are doing this. We have a team of clinicians that are on the phone to respond solely to COVID questions. You're going to have to answer a series of questions, a lot more in depth than just those questions about your most recent exposure. You'll be asked a series of questions that determine what steps to be taken. Please, the emergency rooms are inundated with individuals going in for a screen because they're not feeling well, but they don't have the capacity to manage that. So unless you're having an emergency, a true emergency, you're having problems with your breathing, you're not able to breathe, you're having chest pains, those types of things, then I would stress that you call your primary care provider or call Oakhurst Medical Centers if you're having those more moderate or low types of symptoms.
Great. And also, Sean, provide them with the number from DeKalb County government. We have someone that's COVID-19 line that's available 8:30 to 5 p.m. I can't think of the number right now, but other questions that may pop up in terms of services available. Next question.
This is the last question so far. How can I get testing?
So the way, because we don't have an abundance of tests for everyone in the community to be tested at this time, the CDC has specific guidelines for testing. So when you call your primary care provider or call Oakhurst and go through your screening, if you're deemed necessary for that next step, we would give you the recommendations. We'll tell you, then at that point you are given a number to be tested at one of the state testing sites, or if your primary care provider has access to getting testing through one of our commercial labs, then we would do that. But the first step would be to make that call. Second step, if you are an individual that's identified as someone needing further testing or further evaluating, then we would give you the information and make sure we facilitate you getting that test. Throughout this, though, I will at this point emphasize social isolation. So if you know you're symptomatic, your symptoms are mild, you're not necessarily going to be a candidate at this point for testing until we have more tests available. What you would do is stay home, make sure you're isolating at home, stay away from your family members and pets. If you need to get food, make sure that you're isolating yourself. You're using just one restroom at home, one set of plates. You're not hanging around your family watching movies or playing video games. You're staying isolated in an area until you become symptom-free for at least 72 hours.
Wonderful. Now you see the folks who are viewing this touch point with Commissioner Larry Johnson, how critical, and the questions were so good. I want to thank the folks who asked those questions, because a lot of folks wanted to know those answers. And we got two experts who can help us navigate COVID-19, but also share this video with people later on, and go to CommissionerLarryJohnson.com and share it and send it out so people can understand what assets that we do have in District 3 and DeKalb County that's available to help us. And so I appreciate you all so much, Nurse Charmaine, Mr. Taylor, and what Oakhurst is doing. We have a crown jewel in DeKalb County, and a lot of folks drive past you, but Candler Road has a lot of assets on that road, and you're one of those assets. So please give us your address and phone number on how people can make appointments.
Thank you once again. And our phone number is 404-298-8998. Our address on Memorial Drive is 5582 Memorial Drive, Stone Mountain, Georgia. And on Candler Road, we're located at 1760 Candler Road in Decatur. And again, that number is 404-298-8998. Thank you very much.
Wonderful. Thank you to our guests today. Please tune in next week and tell your friends about us, where we focus on substance abuse and prevention and resources that are available, because in this time, we need to know about resources and how to connect folks with services. We have even provided, as part of our email list, groups around substance abuse, Narcotics Anonymous, that you can do via teleconferencing. So please sign up. If you're not a part of our email list, sign up and get these key resources. Again, I want to thank our District 3 staff, our program managers, LaShawn Atwater, John Craig is our outreach coordinator, Brandon Fields handles all of our administrative work. I appreciate them. And thank you, Oakhurst. You are our first test on doing this Zoom online, and I'm gonna learn how to be a better host next time. But I just wanted to connect with you all first as our inaugural guest, because your role is so critical as we fight this COVID-19 virus. Thank you. Have a great rest of the day. I will see you, Oakhurst, tomorrow. We're going to deliver 1,000 masks for you and the healthcare workers there. God bless you all. Everybody on the sound of my voice, stay safe, practice social distancing, follow the guidelines of CDC, and make sure you pay attention to what our CEO, Michael Thurman, is saying. He is our leader in DeKalb and helping us to get through this matter. Thank you. God bless you all. Bye-bye.